My proposal is for a comprehensive treatment program for the surgical treatment of lymphedema, specifically in association with patients that have had breast cancer, and then also for patients that have had gynecologic and urologic cancers for lower extremity lymphedema as well. So the brief history of treatment of lymphedema is that until recently, all we have really had are conservative measures: physical therapy, compression garments, pneumatic pump devices designed to manage the disease process rather than having any curative potential. Over the last, say, 20 years, reconstructive microsurgeons have been working on trying to develop ways to restore the physiologic function of the lymphatic system in these patients. And there's really been two areas of focus. One being the vascularized lymph node transfer, where we dissect out donor lymph nodes with an intact vascular supply and then transfer it to the area of need. The other component of the surgical treatment of lymphedema is lymphaticovenous bypass. And this is designed to utilize the remaining functional lymphatics in the distal extremity. We identify the lymphatic vessels and adjacent veins, and we perform a super microvascular anastomosis. These vessels are typically less than 1 millimeter in diameter. The best data we have right now for this combined surgical approach, which is what's showing the best results that we've ever had, roughly 80% have a positive response to this in such a way that either subjectively or objectively or both, they have improved lifestyle, limb function, circumferential reduction of the enlarged extremity, and potentially they can stop using compression garments. You know, all of these things are the end result. An improvement in function and lifestyle is really what we're going for. What we really need are two things. We need the super fine microsurgical instrument sets, and then the only other component of this would be a machine that allows us to do real-time imaging and mapping of functional lymphatics in the patient's limb. Time frame for this is as soon as we can get the instruments. I have a list of patients already lined up. I've actually already done several vascularized lymph node transfers at this facility. We just don't have what we need to do the lymphaticovenous bypass at this point. There's really no other program in the region right now that offers this. And so if we get on the leading edge of it, we can really own it as an institution and help the patients in the whole region.